Poor Andrew Lansley. After a torrid spring and early summer, the beleaguered Health Secretary must have hoped the end of the listening exercise would deal with many, if not all, of the criticisms that had been fired at his plans for NHS reform. And indeed, health has not, in the last couple of months at least, been the same headline story it used to be. The second listening exercise was also well received. But does that mean that the amended bill will now breeze through its remaining parliamentary stages? Probably not. First, the listening exercise might have placated some of those with the sharpest axes to grind against NHS reform, but it did not placate them in full, nor did it deal with their concerns permanently. And indeed, the compromises made have thrown up as many new questions as answering old ones. Much remains uncertain. Second, the process to enact these changes remains controversial. Many are concerned that the bill will not receive sufficient time for debate in the Commons. The Lords, through which the bill will pass next, are not likely to give it an easy time either. The Department of Health and Number 10 will not want to see the legislation getting bogged down in parliamentary ping-pong. So, the bill's remaining stages in Parliament are unlikely to be easy, but what does that mean for the broader politics of the NHS and its ability to implement the reforms? First, Health Select Committee Chair Stephen Dorrell has already said the debates about the bill pale into insignificance when compared with the scale of the Nicholson challenge. No health system in the world anywhere has ever had to make 4% cuts year on year. QIP targets have already been missed, and the Audit Commission has pointed out how difficult it will be to get back on track. By 2014, we could well be in a period of even more acute financial crisis in the NHS. Will there have to be a major bailout, or will even more swingeing cuts be made, for example, to the drugs procurement budget? The government's recent response to the consultation on value-based pricing did little to appease concerns that the new reimbursement system would keep promoting innovation in this country. All those who work in and supply the NHS will need to prepare themselves for the possibility that further cuts are on the way. Second, the controversy over NHS reform is going to be quite a gift for the Labour Party over the next 4 years. David Cameron has invested an enormous amount of political capital in NHS reform, and this has helped the opposition to focus their criticism squarely on the PM. Any slight slip in performance will be used to attack the government. We've already seen this with the 18-week waiting time figures. The government will be crossing its fingers that no major assault on NHS reform resources happens this winter. Third, the Liberal Democrats have been given a temporary boost by their ability to secure concessions from the government. We can perhaps expect to see them positioning themselves as guardians of the NHS, which will make the Tories uneasy come election time. We already know Steve Hilton, one of the PM's closest advisers, has become irritated by the slow pace of reform to the NHS. He will not be cheered by any further hold-ups or any posturing by the Lib Dems. And finally, the continual arguments about the nature of NHS reform will perpetuate uncertainty about what the NHS of the future will look like. Morale in the health service is already at a low ebb. It is unlikely to improve while doubt over its future structure persists. It is impossible also to think that this won't have a negative impact on patient confidence in the health service and trust in their healthcare professionals. So the summer has been comparatively peaceful for Andrew Lansley and his team at the DH. They would be well advised to take advantage of the lull, because the winter might be very cold and very long.